Hello, thank you for scheduling your 2025 Medicare plan review appointment with us. And this year is going to be a particularly busy enrollment period. The reason is because there was legislation passed called the Inflation Reduction Act, and that's going to have an impact on the cost of the prescription drug portion of Medicare, what's called Medicare Part D. Now, in order to maintain maximum efficiency, we are implementing two new tools. The first of those tools is a program called Retire Flow. That is a secure system where you can upload your list of prescribed medications and list of medical providers to us in preparation for your appointment. Immediately following your registration for the appointment, you should have been directed to the Retire Flow system. There was also a couple of reminders of the appointment that went out following, and those emails and texts also had links to input the list of medications and providers through that Retire Flow system. If you have not yet provided that through that link, then you'll want to do so immediately, because we need to have that information 48 hours before the appointment, or else we'll need to reschedule it. So if you haven't done it yet, search back in your emails and texts to find that link. If you can't find the link, just give us a call, 210-491-0036. We'll be happy to send it to you, so that way you can get that information submitted in preparation for your appointment. If you have an update, or if you are unsure if you have already done it, well, then you can just do it again. It does not matter if there are multiple submissions. We will be able to tell which one was the last submission, and that's the one that we will use for the appointment. Now, the second tool that we are using is a split appointment. You will see on the calendar invite that was sent to you when you scheduled that the appointment is scheduled for 15 minutes. The total appointment is going to be 30 minutes. Okay. So the first 15 minutes is scheduled with me. And that's the one that you got the calendar invite for when you scheduled it. That 15-minute slot is with me to talk about different plan types, why some people pick one plan versus another, plan selection. And then the second 15 minutes is going to be with my wife, Kira, to work out the details and execute the electronic enrollment. So a total of 30 minutes, 15 with me to work out the plan selection, and then 15 minutes with Kira to execute the plan selection. So I think it's going to work out famously and efficiently. Now, in preparation for our appointment, what I'd like to do is a quick review of a discussion that I'm sure we've already had, and that is the choice between original Medicare and Medicare Advantage. I'm going to keep this really brief. Should be about 5 minutes in total, where we will talk about this. And it's important that you watch this, so that then when we have our appointment, we can go right into and pick up right here with a discussion on original Medicare versus Medicare Advantage, and we can just go right into it during our call. So I'm going to share my screen here. Very good. And now this is my 5-minute Medicare. Two housekeeping items. First one, 2025 Medicare premiums. These are the premiums charged by the federal government for being enrolled in Medicare. Okay. It will be based on your 2023 modified adjusted gross income. The important thing to note in preparation for our appointment is the premium that is charged to you by the federal government to be enrolled in Medicare would be exactly the same whether you choose original Medicare or Medicare Advantage. So that means that what your premium is and why the government's charging that particular premium amount Although it's a conversation, be happy to have with you, just not during this call because it has no bearing on the selection between original Medicare or Medicare Advantage. We can talk about that separately, but we will focus on the plan selection, and the premium has no bearing on the plan selection. The second housekeeping item is I'm going to use a term core health insurance benefits. And what do I mean by that? What I mean is items that are traditionally covered by health insurance. So, three categories: your medical bills, your prescription drugs, and then ancillary benefits like dental, vision, hearing. So, when I refer to core health insurance benefits, that's what I'm talking about: medical bills, prescription drugs, dental, vision, hearing. Okay. Original Medicare or Medicare Advantage. Well, this is a choice that that every Medicare beneficiary must make, and the numbers choosing Medicare Advantage has been increasing over the years. In fact, Medicare Advantage has now surpassed Original Medicare in total enrollment, with 54% of Medicare beneficiaries getting their Medicare benefits on a Medicare Advantage plan now. So 54%, over half, and that equates to about 33 million people now on Medicare Advantage. So I think that it is a good discussion to review in preparation for our call. I will now. One thing important to note on this, now that when I think about it, it's important to note that there are very good reasons why an individual will choose original Medicare. There are also very good reasons why an individual will choose Medicare Advantage. And the important thing for us is that we guide you in to selecting the one that is most appropriate to fit your goals and needs. Okay. Very good. Very good. So I just wanted to make sure and notate that. My role really is in the guidance and to educate you as to why some people pick one and why some people pick the other, and guide you through that selection process, because there are valid reasons for a person to choose either option. Okay, now we will start by discussing Original Medicare. This is a program that's been around since 1966. It's remained relatively unchanged since its inception, and it is a program where the federal government is the primary payer of your hospital and medical bills. In my opinion, the predominant reason why individuals that choose Original Medicare, the predominant reason why they do make that choice is because they want to maintain the most control over where they go to get their medical care. Because the Original Medicare program has no network. You can use any provider that takes Original Medicare without referral. So it's the plan that offers the Medicare beneficiary the most control over picking their own providers. And in my opinion, that's the primary motivator why individuals choose Original Medicare. Now, with the Original Medicare program, though, it's not going to cover all the core health insurance benefits. Basically, it's going to cover 80% of the medical bill. Okay. So what that means is if you choose Original Medicare, it's important that you have 3 additional insurance products. The first of which is called Medicare Supplement, also called Medigap. Those are synonyms. I mean the exact same thing. But what that is that's a policy that you pay extra for. You pay additional to an insurance company. And now the insurance company becomes the one responsible for the gaps in the Original Medicare program. To make the long story short, basically, Original Medicare pays 80% of the bill, and the supplement pays the remaining 20% of the bill. You add those two together, that's 100% coverage. So a person on Original Medicare that has a supplement has the most control over where they go for their medical care, because Original Medicare has no network. And also, a person that has Original Medicare and a supplement has the lowest out-of-pocket responsibility for their medical care, because Original Medicare pays 80% of the bill, and the supplement pays 20% of the bill, and there's very little to nothing left over of the medical bills for the beneficiary to have to pay. But the beneficiary is paying an additional premium to be on that Medicare supplement insurance from the insurance company. In addition to the supplement insurance, original Medicare does not cover prescription drugs. So if you want prescription drug coverage, which the vast majority of people on Medicare want and need prescription drug coverage, but if you're on original Medicare, if you want the prescription drug coverage, that's purchased additional and for an additional premium. So that's two insurance products so far, the supplement and the drug plan. And then to round it all together, in order to cover all the core health insurance benefits, if a individual on original Medicare wants dental vision hearing insurance or dental vision hearing coverage rather, well, that's not covered by original Medicare. So then that would be a third policy purchased, being a dental vision hearing plan. So you got Medicare from the government that you pay the government for, and it pays 80% of the medical bill. Then you have a supplement that you pay extra for to pay the remaining 20%. And then you have a Part D drug plan to give you prescription drug coverage out of the pharmacy. And then you have a dental vision hearing plan to cover dental vision hearing. And that is the three additional insurance products. Now, Medicare Advantage is an alternative to original Medicare. So people that are on a Medicare Advantage plan, what they're on is they're on a plan that is instead of original Medicare from the government. It's not in addition to, it's not a supplement to original Medicare. It's an instead of original Medicare. And so with a Medicare Advantage plan, in my opinion, the primary motivator why individuals choose a Medicare Advantage plan is because they're in search of a bargain. Because the way that a Medicare Advantage plan works is an insurance company bundles together or combines together your medical benefits, your prescription drug benefits, and usually a dental vision and hearing benefits. It combines all those together, all those core health insurance benefits, into one plan from an insurance company. Now, what that does is that avoids needing to buy those three additional insurance products like we talked about with the original Medicare program. And instead, you have one Medicare plan from one insurance company that combines those core health insurance benefits. And what that does is the Medicare beneficiary that's looking for a bargain, it gives them that combined plan. Now, Medicare Advantage plans typically have a network. Okay. What that means is not all physicians take all Medicare Advantage plans or any one Medicare Advantage plan. So if you're on, company ABC, then you got to go to the physicians and the providers that are in the network for company ABC. And every insurance company has their own network. There are two types of networks predominantly with Medicare Advantage. The first one is called an HMO. HMO plans are the most restrictive when it comes to the network of providers, but they also, with the more restrictive network, they really strive to deliver on the value and bargain proposition under an HMO. And then there's also PPO plans. With PPO plans, the network is a little more flexible, a little more open access. It still gives you the combined medical, prescription drug, and usually dental vision hearing without having to go out and buy additional insurance to cover those core benefits. You get that under an HMO or a PPO, but an HMO plan is able to deliver a little more value because of its restrictions, and a PPO plan a little less value, but with a PPO plan you have more open access to picking your providers, and that's how that works. Now, with either an HMO or a PPO, what you're looking at is out-of-pocket expenses, out-of-pocket share of your medical services. So what that means is when you go and have a service done, very rarely do you have 100% coverage. Instead, you have an out-of-pocket share, and that share can come in three different forms. Okay. The first form is called a copay. That's where you pay a flat dollar amount for a specific service. Okay. The second type of out of pocket is called co-insurance. That's where you pay a percentage and the insurance company pays a percentage. And then lastly, there is deductible. And a deductible is where you have to pay for services before the insurance kicks in. And then once you met the deductible, then the insurance kicks in. With all of those types of Medicare Advantage plan, they do have these out of pocket expenses on medical services. And all Medicare Advantage plans have a maximum out of pocket. And what that is that's where your expenses on your medical services, your copays, deductibles, and coinsurance, they add all those up. And if it reaches the out of pocket maximum, then you have no longer have an out of pocket expense for your medical care. At that point in time, you then have 100% coverage for your medical services. So Medicare Advantage plans do have the protection of the out of pocket maximum. Also, with Medicare Advantage plans, there are additional insurance products that are designed to combine with Medicare Advantage or work with Medicare Advantage plans where it provides you with cash benefits so that then you can afford your out of pocket expenses if you encounter them. That's a way that you can actually fill the gaps in Medicare Advantage. That's something that I'll be able to show you during our one-on-one appointment. But it is still important to know with Medicare Advantage plans, they combine all of your core health insurance benefits into one plan from one insurance company. Don't have to buy the additional Medicare supplement, prescription drug, dental, vision, hearing, because it combines those core health insurance benefits. Then you get care provided to you through a network, either an HMO or PPO, but you do have those out-of-pocket expenses in the form of copays, deductibles, and coinsurance up to an out-of-pocket maximum. So that is the story between original Medicare and Medicare Advantage. And we will be able to go right into that discussion during our call. If you have any questions at all, please give us a call, 210-491-0036. You can also shoot me an email, Sean@themedicareman.com. Thank you very much for scheduling your 2025 plan review appointment. And also, thank you very much for choosing the Medicare Man, home of Highway 65, the road to Medicare. Have a wonderful day, and I'll look forward to talking with you soon. Bye.